U.S. leadership ignores World AIDS Day amidst public health rollbacks for the first time since its establishment in 1988. The United States government did not officially observe World AIDS Day on December 1st, while nations worldwide commemorated the day with public health campaigns and official proclamations. The current administration under President Trump chose not to acknowledge the event, a stark departure from previous administrations, including President Biden's formal recognition last year. The scale of the crisis remains since its emergence in 1981. AIDS has claimed over 44 million lives globally, including more than 700,000 Americans. Despite significant progress in treatment and prevention, the disease continues to be a major global health challenge. The lack of official recognition from the U.S. administration raises questions about the commitment to addressing this persistent epidemic. Historical context: Reagan and AMP. Coop's response to the decision to ignore World AIDS Day contrasts sharply with the response during the early years of the epidemic. Under President Ronald Reagan, Dr. C. Everett Koop, a conservative Surgeon General, confronted AIDS as a public health crisis, not a moral failing. Koop aggressively educated the public, even when faced with opposition from within the administration. The Surgeon General should be independent, to advise our country on how to prevent disease and promote good health, Koop stated in testimony before Congress. Reagan, despite internal pressure, reportedly supported Koop's work, refusing to interfere with his appointed role. This historical precedent highlights a willingness from conservative leadership to address the crisis directly, rather than ignore it. Current rollbacks in public health leadership today, the situation is different. When Dr. Susan Monarez, a CDC director appointed by President Trump, took a principled stand, she was fired by Health and Human Services Secretary Robert F. Kennedy Jr. President Trump then upheld the dismissal, signaling a disregard for independent public health leadership. The CDC, once a global leader in public health, is now effectively controlled from Secretary Kennedy's office, where evidence-based decision-making has been replaced with ideological agendas. Funding for crucial programs like the President's Emergency Plan for AIDS Relief, PEPFAR, has been drastically curtailed by the administration's elimination of USAID, a program responsible for saving an estimated 92 million lives over 2 decades. The U.S. has also withdrawn from the World Health Organization, further isolating itself from international health efforts. A pattern of disengagement. The administration's silence on World AIDS Day is not an isolated incident. It is part of a broader pattern of disengagement from global health initiatives, undermining decades of progress. While the details of the day may seem trivial, they represent a deeper indifference to past achievements and a potentially dangerous outlook for the future. The current administration's actions suggest a systemic devaluing of public health expertise, threatening both domestic and international stability. The absence of leadership on World AIDS Day is a symptom of a larger trend, a willingness to dismantle institutions and programs that have historically saved lives.